Welcome back to the deep dive. Ready for another deep dive?
Always.
Today we're looking at GLP-1 receptor agonists. You know, GLP-1 RAs.
The hot topic for weight loss and diabetes.
Right. And get this, it turns out they might have some effects on eye health too.
Interesting.
Pretty relevant for us, huh?
Definitely.
If you want to take a closer look, by the way, we've got a link to the study in the description.
Always a good idea.
So this study is basically saying eye doctors need to watch out for potential ocular side effects.
Even though they're looking promising for some other conditions.
Yeah.
Yeah.
Before we get into the eyes, though, can you remind us how these GLP-1 RAs actually work? They seem to do a few things.
Yeah, they're really multitaskers. They reduce your appetite, like really suppress it.
Mm-hmm.
They also slow down how fast your stomach empties so you feel full longer. And this is cool. They get your body to pump out more insulin,
Uh-huh.
but less glucagon.
Oh, wow. So it's like a total metabolic makeover. I've also heard that the newer drugs like semaglutide and tirzepatide are even more potent than the older ones, right?
You're right. They're like the power players.
I see.
And that means we need to be even more careful about side effects.
Gotcha. Speaking of side effects, one thing that stood out in the study was this possible link between semaglutide and an increased risk of NA-ion.
Oh, right.
I know NA-ion can kind of sound like alphabet soup, so to refresh everyone's memory, we're talking about non-arteritic anterior ischemic optic neuropathy.
Right.
Basically, it's when the blood supply to the optic nerve gets messed up,
Uh-huh.
and that can cause sudden vision loss.
Yeah, it's serious.
Yeah, we definitely want to catch that early.
Absolutely.
So that's NA-ION. What other things should we be looking out for with GLP-1 RAs?
Well, this study also brings up diabetic retinopathy, or DR.
Okay.
They found it could get worse, especially if there's a rapid drop in HbA1c levels, and it's especially true in patients who already have non-proliferative DR.
Hold on. So even though these drugs are supposed to help control blood sugar, they could actually make diabetic retinopathy worse.
Hmm.
How does that even work?
It does seem counterintuitive, right? It's this thing called glycemic reentry retinopathy.
Okay.
Basically, when blood sugar drops super fast,
Yeah.
the blood vessels in the retina try to adjust,
Uh-huh.
but sometimes that can actually cause more damage and leakage.
So it's like their retina is having a sugar crash.
Exactly.
So we have to be careful not to overdo it too quickly, right? Especially in patients who already have DR.
You got it.
It can't be all bad news, though.
Mm.
The study also looked at some potential benefits of GLP-1 RAs for eye health.
Oh, absolutely.
And this is where things get interesting.
Yes.
Like, one finding is that semaglutide might be linked to a lower risk of neuropsychiatric disorders, including cognitive decline and dementia.
Right.
Wait, are you saying a weight loss drug could be good for the brain?
It seems that way. So they looked at a ton of electronic health records, and people taking semaglutide had a lower risk of those neuropsychiatric conditions. People taking other diabetes meds,
That's amazing.
and there's more.
Okay.
Some studies have shown semaglutide and liraglutide could actually improve cognitive function and brain volume.
That's wild.
Yeah.
So they could be protecting the body and the mind.
Potentially. But we need more research to know for sure.
Yeah, I was going to say, that seems like a pretty big claim.
It is. But there are a bunch of trials going on right now to look into this more.
I can't wait to see what they find out.
Yeah.
It's fascinating how GLP-1 RAs seem to affect so many different things. Metabolism, brain function. Talk about a multi-talented drug.
Right.
Okay, before we get too carried away with all the potential benefits, let's get back to the eye risks for a second. We've talked about NA-ion, the possible DR progression with the rapid HbA1c reduction. Anything else we need to keep an eye out for?
Well, there's also this interesting connection between tirzepatide and obstructive sleep apnea, or OSA.
OSA? I never would have thought about that.
Yeah, it is an unexpected link.
I wouldn't have connected those two things.
It's pretty interesting.
Yeah, I know OSA is a problem, but remind me, why is that a concern for eye doctors?
Well, OSA has been linked to a bunch of health issues, including heart problems, stroke, and even eye conditions like diabetic retinopathy and age-related macular degeneration.
Oh, right. It all comes back to the eyes, doesn't it?
It really does.
So helping to manage OSA, tirzepatide could actually have a positive impact on overall health, including eye health.
Exactly. And it's not just about the weight loss. Remember all those different ways GLP-1 RAs work?
Yeah.
Well, they seem to be playing a role here too, like tirzepatide's benefits for OSA. They might go beyond just losing weight, you know? Think about things like improved insulin sensitivity, better blood glucose control, even reduced inflammation.
It's like a whole body tune-up.
Exactly.
Okay, so we've talked about the risks, like NAION and DR getting worse, and this OSA connection. Anything else in the study stand out to you?
Well, one more thing. There's this possible link between GLP-1 RAs and lower intraocular pressure.
IOP.
Yeah. Now, the research is still pretty new,
Okay.
but some studies have shown that these meds, particularly the GLP-1 analogs like liraglutide, they could actually lower IOP.
Wait, are you saying these drugs might help with glaucoma too?
Wouldn't that be amazing?
That would be incredible.
Think about it. Another tool for managing glaucoma, plus all the other systemic benefits they offer.
Yeah. It would be a win-win for patients.
Totally.
I can already see the headlines. Weight loss drug helps patients shed pounds and protect their vision.
Yeah.
But we need more research, right?
Oh, absolutely. We need more studies to see the long-term effects on IOP and if they really do reduce the risk of glaucoma getting worse.
Right.
But the early findings, they are pretty exciting.
It's crazy how many things these drugs might affect. But let's not get ahead of ourselves. We still have to remember those risks.
Oh, for sure. And that brings us to something super important. Patient monitoring.
Yeah, that's key.
Especially in those early stages, when HbA1c levels drop like crazy.
Yeah.
Regular HbA1c checks, those are a must.
What about those continuous glucose monitors? Should we be thinking about those too?
Absolutely. CGM can give us way more info, about how their glucose is fluctuating, and it can help us find those patients who might be at risk for things like the glycemic reentry retinopathy. It's like having a 247 blood sugar watchdog.
That's a great way to put it.
Right.
So it's another tool to help us make sure we're using these medications safely.
Exactly. Being proactive is key.
Speaking of being proactive, what are some things we could do to make sure we're using these meds responsibly?
Well, step one, stay informed. This field is changing so fast. New studies are coming out all the time. We got to keep up with the latest research, both the good and the bad.
So less celebrity gossip, more medical journals.
Well, maybe not entirely.
Okay.
But staying up to date is critical. And once we know what's up, we need to be talking to our patients. Patient education is huge.
Right. We need to have those honest conversations about the possible side effects.
Exactly. We need to make sure our patients feel empowered to be a part of their own care, especially when it comes to their eyes.
And we have to be extra careful with certain patients, right? Like those who already have diabetic retinopathy.
Oh, absolutely. Patients with moderate or worse NPDR, they're the ones we really need to watch closely.
Like a hawk.
More like an owl. Wise and observant.
Okay, you win the bird analogy this time.
Ah.
But really, besides education and being vigilant, what else can we do to manage these patients?
Well, I think the big thing is this. GLP-1 RAs, they're powerful tools.
Yeah.
But like any powerful tool, they have to be used carefully. We can't just prescribe them and hope for the best.
Right.
We need to stay involved, monitor our patients, and be ready to change the treatment plan if we need to.
So it's like a high-powered laser.
Right.
In the right hands, it can do amazing things. But if you're not careful, it can do some real damage.
That's a great analogy. We got to approach GLP-1 RAs with the same level of caution and precision.
So to sum it up, stay informed, educate your patients, watch them closely, and don't be afraid to switch things up if you need to.
Exactly. It's all about finding that balance, between the benefits and the risks.
Makes sense. Well, this has been an eye-opening deep dive, pun intended.
Of course.
I feel like I've learned so much.
Me too.
And I hope our listeners have too.
I hope so. If you're enjoying the deep dive and you found this episode helpful, we would love it if you could leave us a 5-star rating. It helps other eye care professionals like you find the show.
Yes. And don't forget to follow the podcast.
Yes. We love having you as part of our little community here.
And before we go, I want to leave you with something to think about. As we learn more and more about GLP-1 RAs, how do you think these medications will change the way we treat eye conditions in the future? It's definitely something to ponder. Thanks for joining us on the deep dive. We'll see you next time.
See you then.
Okay, so we're back. And we've been talking all about GLP-1 RAs and what they mean for eye health.
It's been quite a journey.
I feel a lot more eye-informed now than when we started.
Nice one.
Had to get a pun in there somewhere.
Yeah.
But for real, I think this has been super helpful. We've learned a ton about how these medications could affect our patients.
Absolutely. We went from what even is a GLP-1 RA to really getting into the specifics.
Right. Before we wrap up, let's do a quick recap of what we talked about. So First, we talked about how these GLP-1 RAs are getting more and more popular for weight loss and managing diabetes.
Yeah, and that means we're going to be seeing them more in our practices.
Exactly. We can't just assume our patients aren't on these meds anymore.
We really need to be in the know about them and how they could affect the eyes.
Right. We also talked about how these medications actually work. They're like little metabolic superheroes, right? They go after appetite, how quickly the stomach empties, and how much insulin the body makes.
They really are multitaskers.
And of course, we had to talk about the risks too, like that link between semaglutide and NAION, and the possibility of DRAG getting worse if HbA1c levels drop too fast.
Important stuff to keep in mind. We need to be watching those things carefully.
Definitely. But it's not all bad news. We talked about some pretty cool potential benefits too, like how tirzepatide might help with obstructive sleep apnea.
That was a surprise for me.
Me too. And we can't forget about that possible link between GLP-1 RAs and lower IOP. That's a game changer.
It really is. That's a whole area of research that's just exploding right now.
And then there's that mind-blowing connection between semaglutide and a lower risk of neuropsychiatric disorders, including cognitive decline and dementia.
I mean, a weight loss drug that could protect against dementia, that would be incredible.
It's almost too good to be true. But we need more research to back it up, of course.
Always.
So what's the bottom line for us eye care professionals?
I think the biggest takeaways are to stay informed, be super observant with our patients, and communicate with them openly. We need to be aware of the latest research, keep a close eye on how our patients are doing, and be ready to adjust their treatment plan if we need to.
It's all about finding that balance, making sure we're maximizing the benefits while minimizing those risks.
Exactly. And that's where our skills and knowledge come in.
We need to be those wise owls, always watching and adapting our approach as we learn more.
Love that analogy.
This has been an incredible deep dive. Pun intended, of course.
Naturally.
I know I've learned a ton. I hope our listeners have too. And speaking of our amazing listeners, if you're enjoying the deep dive and found this episode helpful, we'd love it if you could leave us a 5-star rating.
It really does help other eye care professionals like you find the show and join our community.
We appreciate all your support. Thanks for joining us on the deep dive. Until next time.
See you then.